Hey, 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 everyone. It's Dr. Tamara Beckford with Your Caring Docs. That's right. That's our health and wellness platform where we're going to help professional women, especially your busy professional women, put your health and wellness first, even if it's just for 2 hours a month. And we have our wonderful podcast, Your Caring Docs, Docs Who Cares. Yes, that's where we get our professionals, health and wellness professionals, the doctors. They stop off right here, drop all their knowledge, their gems for you. Biggest part is that they leave their info for you in case you want to be a patient or if you want to be a client. Now, today I have a special guest for you. We'll bring her in Your Curing Doc style. All right. So this doctor, she graduated from Morehouse School of Medicine. So all y'all Morehouse fan out there, woo, woo, yes, HBCUs, all of you guys. Yes, that's how we're doing it today. And she did her residency at Augusta University, formerly known as the Medical College of Georgia, in case you guys are like, what? Yes, the Medical College of Georgia. She did it in urology. I know. We're going to talk about that. You're probably like, what is that? Don't worry. We got you, right? Then, as most of our docs here, they never stop there because they want to take care of patients and they get more and more training. So not only did she do the specialty urology, which is a very challenging specialty, she went further and got a fellowship in female pelvic medicine and reconstructive surgery at the University of Alabama in Birmingham. So welcome, one of our docs who cares. Today we are welcoming Dr. Shenelle Wilson. Woo! Dr. Wilson. Dr. Wilson. Woo!
Thank you so much for having me on.
Oh, I am blessed to have you on. Let's talk about this. Okay. Now I put in and I said that you did your residency in urology. Now, I know a lot of people are sitting there like, okay, that's nice. What did she say? I said urology. So now I want you to come ahead and let us know, what is a urologist and what is urology?
Well, for all of your listeners, don't feel bad if you don't know what urology is. I didn't really know what it was. Even when I was a nurse before medical school and going into med school, I wasn't planning on doing urology.
Right.
So urology is, we are surgeons of the genital urinary system. That means we operate on the kidneys, the bladders, ureters, prostates, vaginas. Anything genital urinary, that's what we're operating on. And we also do some medical management of those systems as well. So just think kidney stones, prostate cancer, urinary incontinence, women or men leaking urine, and vaginal prolapse, to name just a few of the many things that we treat.
Oh, wonderful. So anything starting from the kidneys downward, from the kidneys until you let it out.
Exactly.
In the front. Because the GI takes care of the back. So the urologist is taking care of all of that. You're leaking through the front. Okay, so that's good to know. Now, urology, how did you become interested in this? Tell us your story.
Yeah, so, it's funny. I tell people all the time, one of my favorite shows back in the day was Scrubs. And I remember when they had a female urologist come on towards the end of the seasons. And I was a nurse at the time, and I was like, that's not real. Women don't do that.
Right? They're talking about prostates and male issues. Yeah.
Exactly. But, when I went to medical school, I was still working as a nurse, and I happened to, on my Christmas break, I was working in the ER in LA, and this urologist, now that I'm one, I know that he had a pretty bad call week, but he kept coming in for just this variety of cases. I think the first one was like a priapism. He came in for a stone. He just came in for these interesting cases. And at that time I was in medical school. So I sat him down. I was like, what do you do? And he was the coolest person. One of the things that draw a lot of us to urology are the personalities. He sat me down, took the time to explain what the specialty was, got me on websites, let me help him with some bedside procedures. And from then on, I was hooked. I just loved the mix of medicine and surgery. I loved the focus on quality of life. I'm very big into that. And
Mm-hmm.
just being able to talk to people about subjects that are often considered taboo, that people don't want to share the issues that they're going through. I want to be there. I wanted to be there and be a person who could talk to them about that and then also give them relief. And so, just from there, I was hooked, and I never really considered anything else.
Oh, wow.
Yeah,
Wow. So we go from watching Scrubs and be like, that's a show, that's fake, to, okay, already, I am now working in between med school. And let's forget, med school is hard enough. So not only did at that point, almost Dr. Wilson, she's working as a nurse and she's in med school. And I mean, I didn't drop the big bomb on y'all that she graduated magna cum laude from med school. So even doing all of this, she's still like killing it academically. So we're not talking about the average Joe here. We're talking about like a serious doc who is seriously into her studies and working at the same time. Like shout out and kudos to you for all of that. Wow. So now you get introduced to a urologist and you're like, well, maybe they are real. And then they make this up on the show. And he sits you down and he like lets you enter into this world. And you're like, wow. And from then on, that's it.
Yeah.
So you go in, and urology is a pretty challenging field to get into. And not only did you get into it, then you're like, okay, now I want to do more. And you did fellowship. So what brought you into that part of the fellowship, pelvic medicine and reconstructive, the female pelvic medicine reconstructive?
Yeah. So for those who, that's a very long title. It's, we call it urogynecology. Urologists and OBGYNs can both specialize in the field. Mm-hmm. And yeah, I actually went to residency thinking that I didn't want to do anything related to female public health. I was actually pretty focused on men's health. And then just throughout my experiences, I was able to see that, there were so many things that you could offer up to women. And, just being a woman myself, I know how easy it is to deprioritize ourselves, to put everybody else before us, to kind of suffer in silence. Mm-hmm. And so I really found that, my passion for improving people's quality of life, to really be there for those taboo kind of conversations was really satisfied through urogynecology. Mm-hmm. And it also has a focus on neurourology, helping people with neurogenic issues. Mm-hmm. And so it gave me a really honed in version of what I really wanted to be as a physician. My hat's off to those who are in oncology, treat cancer, and do a lot of the other things. But I wanted to be in a space where, life goes on past cancer and life goes on in general. I wanted people to be able to enjoy their lives. Mm-hmm. and be able to offer them treatments. So.
Wow. And you are doing that, I spoke to another urologist and she's like, this is the happy surgical field. Most of our patients are very, very happy. And most of the procedures or anything that we're taking care of, if it is from the cancer perspective, they have a great outcomes. So, kudos to all our oncologists, which is all our cancer specialists who are dealing with the gamuts of the cancer patients too. We love you. We love you. We love you. All right. So now let's get back to urology. Like, first of all, we're like, okay, this female urologist on Scrubs. And if you guys haven't seen Scrubs, that was a show from, was that like the early 2000s?
Yeah, somewhere early 2000s, maybe to the teens.
To the 2000 teens. And it was about like, it was a show that was on about residents, but it did it in a very comical, it was a very unique way, which a lot of us who went to med school that time, we said, yep, that's true. Once we got into residency. So it was one of the most realistic ones. But one of the things that you have mentioned too is that you saw female urologists and we're like, okay, this is a fantasy. But then also as you're into the field, you started to notice that around, or you getting in there, a lot of people did not look like you. So tell us about this. And, with that, not only did you say, okay, I noticed this, but you did something about it. And that's when Urology Unbound was born. All right, tell us all about it. I'm super excited about this intro.
Definitely. So, I'm not the only one to have been kind of surprised that women get into urology. Women only consist of about 10% of urologists, and that's up over the years. I think when I got in, there were 6% and less, and maybe 10, 15 years ago, they were about 2%. And then Black urologists only represent 2% of the field, and that number has been stagnant, a bit, basically the same. It is the same as it is today. Similarly, I'm an Afro-Latina, and so Latinx urologists only comprise about 4% of the field. And so, I got in there and realized it was just really, really homogenous. And I've always been passionate about mentorship. And I wanted to go into academics initially so that I could eventually help more Black and brown men and women to get into the field. And so that's kind of exactly the impetus for starting Urology Unbound. Just throughout the course of my training, I decided that I kind of wanted to go a different path, not the traditional academic route, even though my eventual goal is to start a urology residency. I wanted to focus on the promotion of Black urologists and underrepresented my urologists. And so in the last year of my fellowship, when everything kind of went virtual because of the COVID pandemic, I started to work with some medical students who were concerned about just the transition, how it would be getting into urology when it's already such a low acceptance rate, and just in general. And then it's even less likely that you're going to be in there if you're a Black or Latinx. And so these student mentees that I'd had, one of them being my brother, who's now in his first year of urology residency.
Woo, go ahead. Wonderful.
They came, they were reaching out and having a lot of questions. And so I just decided to ask my friends who were in urology if we could get together and do a virtual program to kind of tell them, how to approach the application season, talk about interviews, about sub-internships. And essentially, it just kind of grew from there. When I started trying to do something, then all of the things that were possible, all of the needs that exist, all of a sudden it's like, oh, well, we can do something about that too. And so we grew from having just some webinars. I eventually started a pipeline program specifically for medical students so that we would have a space for them to have mentorship, professional development, research education. And then from there, I realized that it's not, medical students don't realize that that medical school and getting into residency is kind of the easiest part. Once you get into training, residency, and then eventual being attending is where so many more challenges come up. And so I wanted to not just funnel people into urology, but have something that was going to be with them throughout their residency and then when they're attending, because I needed support as well. And so we started Urology Unbound to be able to have a 3-tiered mentorship model that addressed students when they were medical students, and then when they became residents, and then through into attendinghood. And so, we're just coming up with different initiatives and programs, abilities, ways to network and promote ourselves so that we can just increase the diversity in the field.
Wonderful, wonderful. You saw something and you're doing something about it. And I will let you know that you and your work is not going unnoticed. Not only were you featured in your top urology society, right? But also, I'll tell you that even just interviewing many, many doctors here on Your Caring Docs, Docs Who Care podcast, I interviewed somebody all the way in California, and she's a urologist, and I told her, I was like, yeah, Dr. Wilson. She's like, oh, I know, I've heard about her. So I said, hey, let's try to connect you guys together. So what you're doing is not going unnoticed, all right? I'm talking to a lot of folks, and people know you.
And it's such a shock, because I'm 1 year out of fellowship. I think my anniversary at my current practice was September 1st.
Wonderful.
And it's so much that has changed in that 1 year, but it also let me know that anything is possible if you just try.
All right. So now, like we said, after residency and attendanthood, like in med school, it's hard. Yeah. Residency, yeah, it's hard. But med school you will not understand how hard residency is. And a resident will never understand how hard a fellowship training is, and neither will the fellowship trainee understand how challenging it is to be an attending. So you've gone through all of this, and now you've even completed that first year of attendanthood. So now we need to know, Dr. Wilson, what do you do for self-care?
Well, I must admit that self-care is very important to me and something that I have been struggling to prioritize, but I know that it is
wonderful.
It's I mean, not just wonderful, it's necessary. We have to take care of ourselves first to be able to take care of our patients, our community, our families. And so it's something that I'm trying to like eke up the change so that it becomes number one, just being able to take care of myself. And so the things I do for self-care, I love to read. I love to travel, which of course has been a little difficult.
COVID closed everybody's passport.
It's definitely been a little challenging there, but I try to do things locally, get outside. I love being outside. So going to the park, hiking up Stone Mountain here in Georgia. Definitely, I'm a very social person, an extroverted extrovert. Spending time with friends, speaking with them, doing a lot of these virtual calls nowadays has been really, really helpful for me.
Wonderful, wonderful. All righty. So now that we found out about your self-care, there's a question that I asked almost all of my guests, and you have decided to answer, which I'm very honored. All right. So now, Dr. Wilson, if you weren't a doctor, what would you be?
Well, I would say that I would be an editor, an editor of books.
Oh, I love it.
Always loved reading. I love books, but I'm not much of a writer. I do so much better when someone gives me something and then I can fix it.
Right.
Than coming up with it and putting it in the right order. It's easier for me to see it and then be that second set of eyes. Nice. And so, yeah, if I wasn't in medicine, I definitely would have pursued a career in book editing.
Wow, wonderful, wonderful. All righty. I love it. I love it. So not only do we have you who have brought in, you're into the urology space. You looked around and you're like, I need to increase the diversity in the space. You've done something about it. You started Urology Unbound, which is not like, let me just get you in, but it's a 3-tiered system to help you get to it, get through the training, and to also help you with mentorship during your attendinghood, which we all need, which is wonderful, wonderful. Doing your self-care, you're hiking, you're out there doing virtual calls and being your extroverted extrovert behind the camera as best as you can, but also to relax and to do your self-care. You are reading, and you knew that, hey, you know what? If I didn't do medicine, I'd be there editing. Yep, editing that book of yours. Wonderful, wonderful. This is a pleasant, and very informative podcast, but I need to know, and I'm pretty sure people are listening. You give us all this stuff about urology and about even increasing the diversity, but people want to know, like, where can we find this awesome doc? Let me know, where can we find you?
Definitely. So I have a website. Please don't judge me. It will be better, but it is.
No, the website is good. We're progress over perfection.
Progress over perfection.
Yes, so I love the website.
Yeah. Well, so there's urologyyunbound.org. That's for my nonprofit. For me personally, ShenelleWilsonMD.com. That's the website. That's the other website that's kind of under construction, but it is there. And then finally, if you want to work with me, if you want to see me, I am currently at Georgia Urology in Atlanta, Georgia. I'm in offices in Midtown Atlanta and in Sandy Springs. And so you can go over to the gaurology.com website and find me there.
Wonderful. So GA Urology, if you would like to be a patient of hers, remember she does urology. She does gyno-urology. So that means she can take care of you male and females, right? So
Yeah.
male and females. And remember, we said that urology, anything starting from the kidney all the way until it exits out in the front, anything in the back, that's the gastroenterologist neighborhood. We're talking about everything that comes out in the front. So for you females, if you're laughing and we're squirting, gynecologist.
Running to the bathroom.
Exactly. You're going to the bathroom a little bit too frequently. If you're finding that you no longer want to go out and hang out with your friends because you are feeling uncomfortable because you are having what we call incontinence. You also deal with sexual dysfunction, right? So male and female, if you're having any sexual dysfunction issues, then Dr. Wilson is the doctor for you. She can handle it all. I told you she is the bomb.com. Do not forget.
I do have one thing to add. I do a little bit that comes out the back, specifically if people are having a little leakage from the backside. I also work with that.
See? I told you. So you know that you are dealing with one of the best right here when you get in contact with Dr. Wilson. She's not only one of the best, but she is one of our docs who cares. So with this, we know that we're going to thank Dr. Wilson. All of this great info is going to be on our www.docs, Your Caring Docs website. That's URCARINGDOCS. And you'll be able to find this on our Your Caring Docs podcast, wherever you do listen to your podcast, right? Apple, Google, Spotify, Buzzsprout, Anchor FM. You can find this great podcast there. And don't forget to leave us a 5-star review. And I know that you will want to get in contact with Dr. Wilson. And please, please, please don't forget that all of this great info will be available. You're going to find her on our Your Caring Docs page, Your Caring Docs /docs-who-cares, right? Your Caring Docs, Docs Who Cares. So we'll see you guys then. And thank you, Dr. Wilson, for dropping by.
Thank you so much for having me. It's been a fun.
All righty. Take care, guys. Bye.
Bye.